We are back taking care of business Saturday mornings. WHP 580 Michael Parks, along with the rest of the Saturday morning crew, taking care of our local businesses and organizations, spotlighting them and showcasing them. And it's a pleasure to welcome back our friends who have been with us from the start here on Taking Care of Business, a great local business who does so much in our community and also for our patients, our good friends at CPRS Physical Therapy. Today, we're going to be talking about low back pain. So if you have low back pain, have somebody, a loved one who is suffering from low back pain, stick around. We're going to have some great information for you on how to deal with that. Also joining us is our good friend, Francesca Kirk from CPRS. Good to see you again, Fran.
Nice to see you as well.
All right. Hey, first of all, we always like to educate our folks and tell us a little bit more about CPRS, what you're all about and what you all do.
Sure. So CPRS Physical Therapy was founded in 1983 in Millersburg. So we're celebrating over 31 years in business. And Rick and Vicki Tribbett, they are husband and wife physical therapists. They founded our company. And since 1983, we've grown to 26 locations all throughout Central PA. And we provide traditional outpatient physical therapy, sports rehab, wellness, and occupational health services.
And it never gets not busy. You know, a lot of people are suffering back pains as they get older or younger, or else they're weekend warriors, and things always happen to people, and it's always good to have the folks at CPRS to help you. I can speak for myself and for my wife and my mother-in-law. We've all been patients at CPRS, and we've all recovered quite well. It's also good to welcome back our good friend Scott Heltzel. Scott has been joining us throughout the time, telling us about a number of treatments and therapies that he and the staff work on at CPRS. And today we're going to be talking about low back pain. How did you get into this, and what basically do you help over CPRS, Scott?
I got into physical therapy, graduated 2002, and started with CPRS physical therapy right out of the gates.
Wow.
And we specialize in orthopedics. We'll treat anything under the sun, but we do specialize in orthopedics. So that means any joint of the body, joint, muscle, ligament, tendons, those kind of things.
Yeah.
And one of the most popular problems that we do see is low back pain.
This is something that I probably think that everybody probably has had to deal with sometimes in their life. It doesn't matter if you're young, old, middle age, athlete, or anything else like that. Back pain is one of those things that affects everybody.
That's very true, Mike. At any age, depending on what your age is, you're susceptible to developing low back pain. There's usually just different reasons. Typically, your 30 to 50-year-old men are most vulnerable to disc problems. If you're over 50, typically you're more prone to degenerative problems, whether that be degenerative disc or degenerative joint problems, arthritis, those kind of things.
I went through it. And for me, it was some silly thing. I went through back pain. It was right when I got married, and we went on our honeymoon to Germany. It was 2 weeks I dealt with it, and I came back, and this was before I knew you. And I went out to one of those free chiropractor services, and I walked in, and the lady goes, you got back spasms. And she said, did anything change in your life recently? I go, yeah, I got married. She goes, man, you're stressed. And sure enough, it was like after that I just calmed down, and that pain just went down. So could it be something simple as that, as stress? What causes back pain and low back pain?
There can be, the list is very long, the things that cause back pain, but certainly something you described in terms of muscle spasm is something we see pretty commonly.
Yeah.
Muscle problems in general, whether it be a muscle spasm, muscle strain, ligament sprain, things like that. Other causes are any activity that whether it be heavy lifting, repetitive lifting, incorrect sitting posture. If you're, like you said earlier, a weekend warrior and you get out and do something that requires a certain amount of range of motion or a certain amount of strength and you don't have that, then you're going to develop some low back pain from that as well. So the list is very long. There's a lot of different factors that are involved in you're being prone to develop.
But I did read that with the way that our society has changed, that back in the day when we were more of a manufacturing and working out and we were constantly moving around. But, that could be a bad thing. But as you mentioned, it could be the problem of that sedentary thing, like at work, where you're just in a cubicle or at a desk looking at a computer screen all day. That can also lead to it, you mentioned, too.
You bring up a great point, because a lot of people have the misconception that if you're a laborer and you're bending and lifting all day, that you're the one that's going to get the back pain.
Yeah.
It's not necessarily true. Sometimes it's the office worker that sits all day. In fact, one of the worst things that you can do is sitting for a long period of time without getting up and interrupting that posture, especially with disc problems. It can really affect the disc.
But it could be something as minor as, like you mentioned, like a spasm, that I went through, but it could be something that could lead to something serious. I mean, how do you know when you should seek help, like from CPRS?
It depends. One thing you want to look for is if you have some localized back pain and it hurts a little bit, wait a few days. It's probably going to take care of itself. But if you have debilitating back pain, hard time getting out of bed, you can't get off the floor, you can't roll over, and especially if it's traveling down your leg. If you have back pain that you feel maybe on one side or both sides and it's traveling down the leg, especially down to the calf or below, down into the foot, that's usually a sign that the nerve is being pinched off by probably a disc. And those kind of situations, PT is very beneficial for.
All right. Is that the sciatic nerve?
That is the sciatic nerve.
Now, I got to tell you something funny because, I grew up in a very, very ethnic family. I had an old Polish mother, and she always used to say, she goes, my sciatic nerve, you guys are driving me crazy. You're making my sciatic. I was like, yeah, it's always your sciatic nerve. Because, back then we knew nothing about this sciatic nerve. And sure enough, as soon as I got older and I started studying certain things, that there is such a thing as a sciatic nerve. So that's a biggie. Is that the big nerve that goes where to where?
It's very, very big. It exits out the lower part of the spine and travels the whole way down to the feet.
Wow.
So it's a big nerve. It's pretty thick. It's a pretty thick nerve. So it can create some significant pain if it gets pinched off.
All right. PT Parks read somewhere that if you have a big wallet and you're driving in your car, that could cause problems to a sciatic nerve pinch. Is that something that you can take the wallet out of your back pocket and move it around? Can that help you?
It's not usually that simple, but I can tell you that having a wallet in your back pocket is not a good idea from a postural perspective.
See?
Yeah. It won't fix the problem taking it out, but it can create a problem keeping it there.
So in other words, they come in at CPRS. What basically happens when you go in? How do you start diagnosing things?
The main thing we start with is taking a patient history to determine what kind of activities provoke the pain, what kind of movements hurt, what kind of positions, and where the pain's located. That's one of the main things we look for. And then beyond that, we do an assessment. We do a movement assessment that will determine. We use repeated movements. We use sustained postures to get a picture of what helps the patient and also what maybe will hurt the patient. And again, we talked about leg pain. The one thing we look for is those positions or those movements that move the pain out of the leg and into the back. That's a sign of a good outcome if you could centralize that pain to the back and out of the leg.
Yeah, but getting to the point of something like this too, it could be anything. Somebody who has not had back pain, it could just develop right away, or it could be like you mentioned, like a traumatic thing, be it an accident or a sports injury or doing something goofy on the weekend, right?
Absolutely. Yeah, it could be what you call an insidious onset, where the pain just kind of comes on and there's no real trauma associated with it. Or it could be an actual injury. Somebody felt a pop, immediate pain down the leg, debilitating pain, couldn't get out of bed. Yeah. So most back pain that I've seen is usually more of a gradual onset. It's a degenerative issue where the patient has had, maybe multiple episodes of back pain in their past, and it's stirred back up again. Yeah.
We see all the things on TV. Everybody always hopes and thinks that a pill can help solve the problems. See those ads on TV with the delivery guy saying, "Oh, I need this one of these pills that'll last me 8 hours and help my back." I mean, so what are those? They basically are just to anti-inflammatory or something, or
yeah. I mean, certainly medication has its place.
Yeah.
And we there's oftentimes if we're talking about that patient who feels a pop and they can't move, certainly getting some anti-inflammatories in may decrease their pain enough to get into the clinic. And it does help us do what we need to do. But oftentimes there's something underlying anatomical that needs to be corrected that a pill can't correct, but it can help us do what we need to do.
You got to find the cause. Scott Heltzel, Fran Kirk joining us from CPRS Physical Therapy. CPRS Web is their website where you can find their location, find out all that they do, and get in contact with them. All right, we always love to talk to patients that you guys help and treat and hear their stories of what's going on. And we have a special guest today. I want to introduce our guest, Scott.
We have Stephen Heisey with us today. He is from out in Lewisberry, Pennsylvania. And he came to us to see us in the Lewisberry office with low back pain and some radiating leg pain.
Yeah. Steve, you with us?
Yes, I am.
Hey, Steve, thanks so much for joining us today. Why don't you tell us What happened? How you got injured?
The beginning of August, the end of July, this past summer, I was doing a lot of exercising on my own, a lot of dumbbell work. What I might have done was overdid it in what they call like a side bend exercise, where you hold a dumbbell in one hand and you put your opposite hand behind your head, and you just bend to the side, and you do multiple repetitions on each side. And I think that might have been what did it in my case. I started getting numbness in my left leg, and I stopped doing it, and the numbness just stayed there. And I knew it was time then to see a doctor, my family physician. I went to him. He gave me a prescription. He gave me a small, a minor adjustment on my lower back. That's when he said I had a sciatica issue down my left side, and gave me a prescription for some anti-inflammatories and some medication for pain, and said, see you in 4 days. Well, when 4 days were up, he said, how do you feel? And I said, I need the physical therapy.
Yeah.
That's how I felt.
Yeah. How did you pick CPRS?
They were recommended to me by my physician.
Good.
And their location was perfect. They were only like 7 miles away. I went to the Lewisberry office. That's how we got set up. I do believe my doctor sends most of his patients there.
That's a great point too, and then we want to remind folks too that along with the doctors recommending, as our good buddy Jeff Shields always says, is that you do have a choice when it comes to physical therapy. So the doctor may recommend someplace else, but if you do want to go to the best, consider CPRS, and that's exactly what Steve did. So Steve, what were the treatments like at CPRS? So what did they first do? I assume you work with Scott, right?
I originally worked with Scott, that's correct. Then I switched back and forth between him and another gentleman named Nick. I can't recall his last name right now. The beginning was just the first appointment. I went in there, I could hardly move. I mean, really, I had a lot of pain down my left leg, below my left knee, down into my calf area, into my buttock area. And basically, Scott did some tests and did a lot of diagnosis the first visit, and told me, which didn't really sound very promising, but he did say that pain that we have running down that sciatica down my left side, we're going to try to get that into your lower back. We're going to try to move the pain into your lower back, and we're going to start doing exercises that will allow that to take place. I was very skeptical at first, and I told Scott from the beginning, I was coming upon a pretty active part of some traveling that I was going to do. So it was kind of like wanted to really expedite the process and get it done as soon as possible. He started me off on these lumbar extension exercises on the table where you arch your back, back into a back position slowly. And we went from there. I also received a little bit of massage treatment on that spine area, as well as we graduated then into like an exercise ball extensions on the ball on the floor. I think I went probably 8 or 9 sessions. When I got to about the 4th session, I thought, well, this is going to either make or break it here. I'm going to have to, and I was doing the exercises they gave me. I did them at home as well. I wanted to get rid of this pain, and I couldn't believe it. That slowly it started behind my knee. It started to feel much better. Then the pain was slowly moving away from where my hamstring area is, and it went exactly where they said, into my lower back. But that was a good pain. It was much better than the nerve pain that went down my leg.
Yeah, I bet. Steve Heisey is joining us, Scott Heltzel and Frank Kirk from CPRS. We're going to take a break, and when we come back, we're going to continue our conversation with Steve and Scott. Again, you can find out all about CPRS. Go to their website, which is cprsweb.com. Of course, all the contact information. Hear this interview again on our website at whp580.com. Click on Air, then Michael Parks. We will continue in a bit. We are taking care of business on Saturday mornings on WHP. Taking care of business Saturday mornings, WHP 580, Michael Parks, along with Scott Heltzel, Frank Kirk from CPRS Physical Therapy. Today, we're talking about back pain, low back pain, how to deal with it, how to treat with it, and how to get you back into the game and onto everyday life. It's something that affects so many people, and we're talking about the causes and the strategies involved and what you can do. There is help other than just popping pills all the time and just trying to, you got to find the cause and get the cure involved here. Also joining us is Steve Heisey, one of the patients. One of the things, Scott, that he mentioned that, he had a problem with his sciatica and you diagnosed that. And then the strategy, as he was saying, was that you needed to move it up to the back. Explain that.
That's called a centralization phenomenon. Yeah. And what we do is what's called a McKenzie evaluation. In the McKenzie evaluation, you basically start with a movement assessment. So you do repeated movements or sustained movements to determine what positions either centralize that pain to the low back or move it further down the leg. Obviously, the ones that centralize it to the source of the problem, which is the back, are the ones, this is the direction that you want to go.
Okay.
So what Steve was discussing was the extension exercises where he would actually lay on his stomach and press up. And what that does is puts pressure on the disc and puts moves the fluid in the right direction, taking pressure off the nerve, creating less leg pain, and centralizing it to the back.
Yeah. Steve, you mentioned before the break, how you were doing this, working out with dumbbells, and then you knew that there was pain, there was a problem, and it wasn't going away. It wasn't something that, it was going to heal itself, and you went to CPRS. They put you through the motions, and you being the good patient, did all the exercises that they gave you on the off time. I want you to tell us, how intense was that pain and how is it now?
On a 1 to 10, the first day I walked in there, I was probably like 8.5 or 9.
Wow.
It wasn't like my eyes were watering, but it was pretty bad. And it was intense even during the treatments, during the sessions that I had. There were a few times where the pain got shot back up to maybe that 8 number, and then gradually moved back down. And probably about after 4 treatments, I was halfway at about a 5, and now absolutely, positively nothing, 0.
Wow.
I feel great.
Yeah.
I feel great.
And, you've been able to get back. In fact, you're on the road. You're down in Florida, so you do a lot of traveling. So, I mean, this what was it? It was in August? August when this happened to you?
Yes, it was. It was the beginning of August, and I had 9 treatments throughout the middle of August, and then I left the end of August around Labor Day, and haven't really been in and out of the area that much since then. However, I continue to do those exercises daily.
And Scott, is that something we always talk about? Is as much you love dealing with us as being patients, but what makes you guys happy is like when you don't have to see us anymore. There are exercises that you can do. What's the strategy involved there? Just to keep it nimble, moving, or is he going to have problems down the road?
It does depend on the problem. The main thing is when you come to the clinic, we are there to do what is necessary to make you better, whether that's certain modalities like ultrasound, electric stimulation, massage, joint mobilization, hands-on treatment, and of course exercise as well. But you can only get so much better by coming to the clinic. You have to do things between sessions as well.
Right.
And the whole goal is to get the patient to eventually self-manage their problem. Obviously, Steve got to a point where he was not having pain anymore. He's absolutely no pain, but in order to maintain that level, you want to continue to do the program.
Yeah.
And in Steve's case, more or less to keep that disc material where it should be and to keep things around that disc stable.
All right, Steve. As we wrap things up here, we always talk about the having the quality and the best possible people working on you at CPRS. What do you have to say about your experience at CPRS and any advice for folks out there who have low back pain?
Outstanding. They're outstanding from when you walk in the front door. The woman behind the desk is a receptionist. It's very friendly. The therapists are excellent. They try to make you feel at home. And I'm not just saying this. I mean, I was very apprehensive when I went in there. I had never had to deal with any type of therapy before. And the whole experience was very, very, very overwhelming to me and how I was treated. And I'm talking to you right now, and I'm pain-free. And my lower back is just totally pain-free. I would highly recommend them. And just think that don't be afraid. If you have a pain, don't be afraid to go and have somebody look at you, diagnose your issue, and stretch that pain out of your back or any part of your body for that matter. There were a lot of people in there getting a lot of different things done to them, and everybody felt very, very good when they were leaving.
Steve, thanks for joining us today, and we're glad that you're back in the game and back to living and loving life. And the folks at CPRS can do the same for you. If you this weekend, again, it's going to be a nice weekend. You're going to be out and about. If you do develop back pain, and we hope you don't, but if you're suffering from back pain and you just don't know what to do, and again, you quit popping the pills, find out what's causing that back pain, contact the folks at CPRS Physical Therapy. Go to the website to learn more, cprsweb.com. And, of course, all the contact information on our website at WHP580.com. Click on Air, then Michael Parks. Scott, Fran, always great seeing you, and we'll let you get back to work here.
Thanks for having us.
Medical Matters is up next, followed by The Plant Doctor. I will talk with you next Saturday morning at 7. I'm Michael Parks, and we are taking care of business on Saturday mornings on WHP.